The big three stack to prevent hair loss for newbies 101. Ketoconazole shampoo, a mild anti-androgen that also can help clean up the environment of your scalp. Use it once every other day. Finasteride, 5-alpha reductase inhibitor that is very effective at completely halting the miniaturization process for many people. A typical dose is 1 to 1.25 milligrams, but a responsible entry-level dose would be 0.25 milligrams per day. Discuss with your doctor. Minoxidil, topical growth stimulant that can be used concurrently with your finasteride and ketoconazole shampoo. Apply 1 to 2 times per day, morning and night, although 1 time per day should be sufficient using a 5% concentration. Microneedling device, something to add to your protocol if you are going to be using minoxidil to double the results that you get from it.
So I think this is a very nice review. I don't agree completely with the 3 products as the 3 most effective products. I do think that finasteride, which is FDA approved just for men at a 1 milligram dosage, is very effective. So that is an effective choice for men only. And that's something to speak to your physician about potential side effects, but it's effective for maintaining and thickening your hair. It is a 5-alpha reductase type 2 enzyme inhibitor. Minoxidil also is effective. It comes in a topical form, which is FDA approved. It also can come in oral, which is technically off-label, but it still can be effective. Sometimes it's a little bit easier to use. The oral is something that you would take that once a day. The topical would be once or twice a day. That could be used by men or women. Once again, the topical is FDA approved. The oral is off-label, but something you can speak to your physician about as well as to which one is better indicated for you. So those are 2 medical treatments that are effective. Now, he talks about ketoconazole, and while I do think that there is a place for ketoconazole, it can work as an anti-inflammatory. There is some evidence that ketoconazole can help to stimulate, help to strengthen, help to thicken your hair as well. You use it once or twice a week, so I think that it can be used. I don't think it's in the top 3. I would put as in the top 3 PRP, platelet-rich plasma injections, and that's a treatment where we draw your blood, it gets spun in the centrifuge, we concentrate the platelet-rich plasma portion of your blood, and then we inject those platelets into your scalp. What's really important is how it's injected, the depth, the concentration, and the location in terms of obtaining a very nice result. So for men, I think finasteride, minoxidil, and PRP are 3 of the more effective treatments. For women, it would be minoxidil and PRP. Ketoconazole shampoo can also be used in addition and in conjunction with any of those treatments, so that's something that you should keep in mind. Whether or not to microneedle and whether it increases the effectiveness of the minoxidil, whether it doubles the effectiveness of the minoxidil as he states in this video, I'm not sure about that. I'm not sure if there's really that much more effectiveness of the microneedling with the minoxidil. Patients can do it, but I don't think it's clear as to how much more effective that may be. There's also other treatments that are out there in terms of vitamin treatments like Nutrafol or Viviscal, laser caps or red light, low-level light therapy, those red light diodes in a helmet or a band or a cone that you may have seen. Those may have some benefit as well. I wouldn't put them at the top of the treatments. I would say the 3, once again, for men, finasteride, minoxidil, PRP, for women, minoxidil, PRP. And I think that they can be effective, and to speak to your physician more about them.